What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May. We're starting today's deep dive with some numbers that, well, they should really shock all of us, but somehow we've gotten used to them.
We really have. We're talking about traffic fatalities.
And it remains one of the greatest yet most preventable public health crises in the United States.
Exactly. When you look at the raw figures, the scale of it all is just staggering. 42,939 people killed on U.S. roads in 2021 alone.
42,000.
I mean, that's more than a serious epidemic, yet it rarely gets treated with that same kind of urgency. And the U.S. fatality rate it's just so much higher than in other high-income nations.
And what makes this a critical public health failure, not just a transportation issue, is who's dying. Motor vehicle crashes are the leading cause of death for people 5 to 29 years old.
We're losing our future. And that's why our mission today is to analyze the framework for reversing this, which is all laid out in a comprehensive review from the New England Journal of Medicine in 2025.
A really authoritative source.
Absolutely. And it argues that these deaths are, and I'm quoting here, not inevitable. It outlines evidence-based strategies to get to, zero deaths.
Okay, so let's unpack that, because getting to zero requires a fundamental philosophical shift, right? It means we have to redefine responsibility.
A complete redefinition.
Yeah.
The U.S. DOT adopted this thing called the Safe System Approach back in 2021.
So what does that actually demand of us?
It demands a complete paradigm shift. I mean, historically, if there was a crash, the focus was almost always on blaming the driver.
Right, driver error.
Exactly. The Safe System Approach moves responsibility from just the individual to a holistic system. Everyone's involved.
So not just the person behind the wheel.
No. We're talking road designers, vehicle manufacturers, policymakers, law enforcement, and crucially, healthcare professionals.
Right.
Everyone shares the burden.
I think that's the most transformative part here. The idea that the system itself has to protect vulnerable humans from their own, inevitable mistakes.
It operates on 6 core principles. The first is non-negotiable. Deaths and serious injuries are unacceptable, period.
Okay.
The second and third acknowledge our limits. Humans make mistakes, and humans are vulnerable to the forces in a crash.
And the final 3 principles, they define the solution.
They do. Responsibility is shared. Safety has to be proactive. You design the risk out of the system before a crash even happens. And finally, redundancy is crucial.
Redundancy, so multiple layers of protection.
Exactly. If one fails, the next one is there to save a life.
So if we apply that framework, we have to start with the most unpredictable factor, the human element.
The people. Yep.
So diving into that safer people component shows that crash risk is fundamentally unequal. We have to protect the most vulnerable. Age, for instance, plays a huge role.
It really does. The data on young drivers is stunning. Male drivers, 16 to 20, their fatality rate is 60.3 per 100,000.
Which is more than triple the overall average.
It's a crisis centered almost entirely on young men.
So what actually works to counter that? The source points to graduated drivers licensing GDL policies.
And they work because they are a systematic, proactive control. They restrict high-risk situations, like driving late at night or with a car full of teenage passengers, until the driver has more experience.
The system is protecting the driver from their own inexperience.
Precisely. And what's fascinating is the future isn't just about restriction, it's about active monitoring. The review talks about tech that can monitor driver performance and give real-time feedback.
Like having a virtual driving coach in the car 24/7.
Exactly. But we can't just talk about age. We absolutely have to address the profound equity issues in this review. The racial and ethnic disparities are a critical public health concern, especially for pedestrians.
This is where the statistics are just heartbreaking. I mean, they force you to look at systemic failures. American, Indian, Alaskan, Native pedestrians are 5.1 times more likely to die than white pedestrians.
5 times.
Yeah.
And non-Hispanic, Black African-American pedestrians are 2.1 times more likely.
That kind of disparity.
Yeah.
It just screams for intervention.
It speaks to decades of underinvestment. These aren't random numbers. They're a roadmap of systemic issues. Poor road maintenance, bad lighting, no safe sidewalks, communities relying on high-speed roads because there's no good public transportation.
So the system failed them long before they even stepped onto the road.
Absolutely. Now, beyond that, we have to tackle specific high-risk behaviors. Impaired driving, for one. It's still accounted for 31% of all fatal crashes in 2021.
And that figure is so stubbornly high, even after decades of campaigns.
It is. But the very definition of impairment is changing, which makes things harder. The source notes the rise of polydrug use. Over half of fatally injured road users test positive for one or more drugs.
So not just alcohol.
Not anymore. We're talking alcohol, cannabinoids, stimulants, opioids, often in combination, which is far more dangerous.
So you need that synergy of policy and technology. High visibility enforcement like sobriety checkpoints still works.
It does, but the tech mandates are crucial. The review mentions passive intoxication detection and the mandate for ignition interlocks from the 2021 Infrastructure and Jobs Act.
And interlocks are a perfect example of that redundancy. The system detects impairment and just prevents the car from even starting.
It removes the chance for that fatal mistake entirely.
And we can't forget what seem like simple things. Not wearing a seatbelt contributes to half of all occupant fatalities.
Even though almost 92% of people use them, the ones who don't are the ones most likely to die.
Then there's distracted driving. It's a factor in 29% of crashes.
And that's skewed heavily toward our youngest drivers, this 16 to 24 group. Studies show at any given moment, 4 to 5% of them are physically using a cell phone while driving.
And legislative bans are hard to enforce. So again, it comes back to technology in the vehicle. Forward collision warnings, driver monitoring systems that literally track your days.
The car has to manage the driver's attention.
Shifting gears a little, let's move to the next pillar, safer roads and safer speeds. The core idea here is that road design has to engineer the risk out of the system.
Right. The infrastructure itself has to protect you when someone makes a mistake.
So you design roads so that even if there's a crash, the impact forces stay below the level that would be fatal.
Exactly. And this is where infrastructure investments show incredible returns. Take intersections, for example. They account for over a quarter of all traffic deaths.
Okay.
But just replacing a traditional intersection with a traffic circle, a roundabout, can cut fatalities and serious injuries at that spot by 70 to 80%.
70 to 80%. That's a massive public health victory just through design.
It is. It's all about managing kinetic energy. It forces drivers to slow down.
And we have to talk about pedestrian deaths, which are tragically on the rise.
And they are so predictable. 75% happen mid-block, away from an intersection, and 77% happen in the dark.
So the solutions are right there. Physical barriers between sidewalks and roads, dedicated bike lanes, more lighting, and narrowing the lanes on roads to naturally slow traffic down.
You design for human vulnerability. And there's this huge emerging opportunity with vehicle-to-everything communication, or V2X.
That's where cars talk to other cars and to the stoplights, right?
Right. It's real-time hazard detection. And the fascinating thing the NEJM review points out is that the technology is ready. We know how to do this, but we're stuck in a classic regulatory deadlock. The industry and regulators just haven't agreed on the technology and a roadmap for deployment.
So the safety tech exists, but it's stalled by bureaucracy. That's frustrating.
It really is. And we can't talk about safer roads without safer speeds. Speeding was a factor in 28% of fatal crashes. We saw this during the pandemic.
Right, speed risk went way up.
By 30 to 40%, probably because there was less traffic enforcement.
And we know automated enforcement, speed cameras, and sensors works. Globally, it reduces injury crashes by 20 to 25%. But here in the U.S.?
Here in the U.S., it hits that cultural wall.
A huge one. Why is that?
There's just so much public opposition. A lot of it is tied to concerns about privacy and equity, this idea that it targets certain neighborhoods unfairly.
So it's not just about selling a safety measure. You have to solve that tension between public safety and, this very American prioritization of individual freedom and anonymity.
Exactly. You have to address those equity concerns head on before you can get anywhere.
Let's move to the final two layers of defense here. Safer vehicles and post-crash care. I like the analogy of preventative versus acute medicine for vehicle safety.
It's a perfect analogy.
Yeah.
Passive safety is the acute medicine. It protects you during the crash. We're talking about airbags, crush zones, seat belts with pretensioners.
They manage the energy once the mistake has already happened.
Then you have the active safety systems, which are like preventative medicine. They help you avoid the crash entirely.
And the big regulatory win there?
It's massive. Automated emergency braking, AEB. It's mandated to be standard in all new vehicles by 2029.
So the car will brake for you if it senses a crash, often before you can even react.
And it's predicted to save thousands of lives every single year. But this advanced automation, it brings a new challenge. Human misuse.
Right. We see people over-relying on these systems, assuming the car can just drive itself.
Which is why the newest systems also have to monitor the driver. They track head position, eye gaze, to make sure the human is still paying attention.
The final line of defense then, after everything else has failed, is post-crash care. immediate medical response.
And the sources make a powerful case about the rural disadvantage here. Longer EMS response times and bigger distances to trauma centers are directly linked to higher death rates.
The disparity is alarming. In urban areas, about 10% of crash victims wait an hour or two to get to a trauma center.
But for rural victims, that number jumps to 39%.
39%. That delay is often the difference between life and death.
And that's a direct challenge to healthcare administrators and city planners. When you make a decision to close a rural hospital, you have to weigh the fact that you might be inadvertently raising the road death rate for that whole region.
And technology can help bridge that gap, right? Crash notification systems that automatically call for help.
They can. But the challenge, and this is a recurring theme, is equity. Many of these systems are subscription-based.
Creating a financial barrier for the very people who might already be at higher risk.
Exactly. So when the authors pull all these layers together, they use the classic Haddon matrix, what happens before, during, and after a crash.
But they add a crucial new category.
They do. They add prevention. The strategies applied long before a crash could ever happen, designing systems and policy to eliminate risk from the start. They argue that's where we can make the biggest difference.
So to conclude this deep dive, we come back to the sheer scale of this problem. Over 42,900 fatalities and 2.5 million injuries in just 1 year. The need to reverse this trend it's urgent.
And success requires full commitment from everyone. The sources really call out physicians and healthcare administrators to get involved, to advocate for these policies, and to educate their patients. Road safety is public health.
And here's the really provocative thought, something for you, the listener, to mull over. The researchers say achieving zero fatalities faces huge challenges rooted in, well, cultural and societal factors specific to the United States.
And that's the real fight, isn't it? The prioritization of massive vehicles, high speeds, and this deep-seated culture of prioritizing individual freedom above collective safety.
We often treat driving as an absolute right, not a responsibility.
Exactly. And yet, the review insists that despite these profound cultural challenges, embracing this safe system approach is the only path forward. It's how we save every life, regardless of age, race, or where you live.
It's a reminder that every single one of these deaths is a preventable failure of the system.
Thank you for joining us for this deep dive. Be sure to subscribe and share the channel.
This has been What the Study Says.